Welcome to part 3 of this lecture series. First, I want to make it clear that what we are going to learn in this lecture is not how to create a program to increase running performance. Rather, look at how posture can inhibit performance and how injuries can be influenced by posture. As we discussed in part 1 briefly, performance is relative and is based on many factors. One of these factors is injury. You can still have a high level of running performance when you're managing an injury related to posture. So, for example, if you're, let's say, training for a marathon, and during that time that you're training and you're following the programs and the volume and all that in terms of the program protocols, you might come across that your knee or your toe or your hip, something is going on with that, and it hurts, it's painful. But you obviously cannot just stop all your training because you're signed up for a marathon and you want to be able to accomplish that. So you're going to obviously make changes within that time frame that you have during your training to try to get through it. So whether that is decreasing your performance relative to the fact that you're before you weren't injured and now that you are, or you're feeling some type of pain happening during your training. So does that mean that you're not going to be able to complete the marathon? Maybe, maybe not. But if you obviously are still training and you're still able to run and you're still able to perform, then you'll probably get through it and be able to finish the marathon, so on and so forth. But again, it's relative to the fact that you are injured and finding ways to work around it. So now imagine again that taking the same efforts that you took in your training to get to accomplish a marathon and doing it where you're not injured, now you can maximize performance without the limitations from injury. So I hope that does make some sense in the concept. Uh, Now, putting it all together. So, in part 1 and part 2, we really kind of focused obviously on posture, and then we part 2 we focused again on posture, and then identifying distortions, and then even putting you through the ability to even practice doing assessments on your own. Um, but in this lecture, I'm going to discuss what is running performance. Again, putting it all together, putting everything that you've learned prior, and discuss briefly some of the contributing factors in the decline of running performance. Discussing kinematics and anatomical analysis of the running gait. And then we're going to link how posture and kinematics are important to understand. Then how training can be influenced by posture. So going back, making sure that you kind of understand that, if you have an elevated hip on the left side, that is going to have an effect on your running gait. Even if it doesn't hurt, it's still going to have an effect. And then we're going to do a mechanical analysis. So, what governs running performance. And then right at the end, similar to what we did in part 2, you're going to test your knowledge and there'll be a practice activity. So this will require some two types of apps to be downloaded, one for the iOS and one for anybody who's using Android. So that's it. That's just giving you an intro to what's coming up next, and go to the next slide. All right, so in many cases, runners believe performance is based on going faster and for longer periods of time, which is absolutely true. However, that is one element of performance. And I'm just only going to touch on just a couple of them here, but um, it's it's important to understand when I talk about performance. Performance is basically a collective of all these elements that I'm not going to touch on all of them, but it's important to remember that all these elements have to be in place for performance to be increased. So the other element that I'm going to touch on is staying injury free is another part of performance, and for obvious reasons. If you are injury free and working from an ideal posture, performance enhancement related to speed just becomes more efficient and effective. And when I say performance enhancement, that's talking about any of the training modalities that are being used to enhance performance. Um, but if posture distortions are present, this may lead to injury, limiting performance. Now, not that does not mean decreasing performance, but it puts the person or the runner in a new realm where they have to increase performance while having some form of limitation. So basically, but limiting the ability for a runner to achieve optimal training effects is one of the reasons why. So if you're training and you're training from an injured perspective, then that optimal training is only going to be optimal within that perspective of being injured. So here's an example, and it's commonly known. It's a commonly known posture distortion in the running world, and we probably have all heard of it, especially if you've ever gotten fitted for running shoes. Pronation, and basically pronation is the inward tilt of the ankle, with the weight being increased on the inner position of the foot. So what this means, just for example, is if the runner's foot is pronated, then throughout the gait cycles, the muscles in the foot and ankle may not be working as efficiently and result in muscle imbalances through the rest of the kinetic chain. We will go through this a little bit more as we go into the kinematics and the anatomical analysis of the gait cycle. So, but some of these general principles that are related to like pronation would be like the foot strike mechanics. So just keep that in mind moving forward.
All right, let's discuss briefly the contributing factors in the decline in running performance. As you can see on the slide, the contributing factors listed there is age related, posture changes, and injuries. Those are just a few, but they're common. This is important when considering how to approach a runner associated to posture and how to develop a program around increasing their running performance. So, some age related. So, for example, some age related issues may be present regarding runners with arthritis in the knees. Now, this is something you can't fix per se, but you can identify areas that might be compromised because of the arthritis. Another age related issue that has been observed in older runners is related to running technique and is associated with mechanics such as decreased muscle strength, reduced oxygen uptake, and other physiological changes during aging. Um, so, moving on to posture changes. When examining posture changes or postural changes, this can be caused by many different factors, such as a previous injury, lifestyle behavior, underlying medical conditions, for example, scoliosis. An example of an injury that was unrelated to running, such as a fall, where you hurt your shoulder, and this is causing compensations during recovery. This may result in an elevated shoulder and trunk rotation. This obviously can have an influence in how you run. So, moving to injuries, there are many types of common injuries that can be associated to the movement of running. And as mentioned before, running is not necessarily a cause for the injury, but what may bring a distortion, a postural distortion, or a deviation to light. And the injury is just the body's signal to you. Injuries associated to running, though, have been linked to kinematics. To give a quick definition of what kinematics is, it's a subdivision or subfield of mechanics that examines the specific points of motion without the concern of other factors, uh, such as, momentum, which is an outside force, which would apply to kinetics. Um, so injuries have been commonly related, though, to kinematics. Uh, and running kinematics is the examination, again, of specific points involved in that specific movement or motion. To give an example of how kinematics and then posture, how they link together, is hip dysfunction. If a hip dysfunction prior exists to like any running or any kind of activity, has a resulting influence on posture distortion. In this case, it could mean that you are, because of the hip dysfunction, could have more adduction, which creates knee valgus, which we discussed earlier before. And that has been suggested to be a contributing factor in knee pain. Hip dysfunction also has a contributing factor to iliotibial band syndrome, tibial stress, and gluteal tendinopathy. So, without going through all the definition of what these are and everything, what you want to think, again, you will not need to be an expert, but it is good to understand possible root causes rather than just assume it was the action itself, like it was running that caused it, rather than the reaction. We are now going to briefly look at the running gait and look at each of the phases and subphases within the stride cycle. First, let's compare and contrast the running from walking. The difference between running and walking is mainly related to the joint actions within both movements. Simply put, it is a matter of degree and coordination. However, the joint actions are essentially the same, but the range of motion in running is generally greater. That makes sense, and that's pretty obvious. The difference in coordination is observed during the period of the non-support phase, or what they call the flight phase. So again, looking at walking, imagine yourself walking. At no point in time your body actually leaves the ground in its entirety. During a run, there is a point where all of the body is lifted off the ground. So there is no contact with the ground in a certain phase, which is the flight phase when running. So there are two main phases, and these are the swing phase and the support phase. In the illustration or the picture you see above, I've broken down the swing phase to early swing, mid swing, and late swing, which is also referred to as the terminal swing. So as you can see, starting from the left to right of the picture, looking at the right leg first, you see that it's in the support phase. And then when you look again at that right leg as the person is propelling forward in that image next to it, you'll see the swing phase to begin, which is considered the early swing. So looking further, you're looking at the left leg in the drive phase, and also the right leg is part of the drive phase in the in propulsion. So then moving further towards the center of the picture, you'll see the figure in the middle. You can see that the right leg is in the mid swing phase, while in flight phase, this is where that major difference to walking is apparent. So And then looking further, you see there is the late swing. So on the left foot in that middle uh, picture of the main picture. Um, the sub phases that you want to kind of pay attention to is the flat foot, which is basically the support phase, or it's correlated with the support phase, while where the foot makes the initial contact with the ground. And then that's where the toe off phase or is beginning to prepare going into the drive phase. So this just hopefully gives you kind of a better understanding. And I like to use this visual to really, I mean, it helps me kind of take and break it down so it's easier to understand. Again, this is not something that you can try to memorize all in one shot. Through doing and watching people and watching your clients or athletes, you'll start like identifying more of this as you move forward in incorporating this in how you look at your clients or athletes. All right, so now that we have a little better understanding of the running gait, let's briefly look at the mechanics. Now, this is more related to the kinetics rather than the kinematics. Again, let me be clear, I will not be discussing the different running techniques such as foot strike patterns, such as forefoot, midfoot, or heel strike. Plenty of research has been done on those in regards to looking at increasing running economy, which is better, avoiding injury, that kind of stuff. So that is for a different lecture or a later lecture. So let's move. What governs propulsion and speed associated to mechanics? Well, what governs speed is stride length, and optimal stride is essential for efficient mechanics. Better runners generally have greater stride per given pace than less efficient runners. The length of the stride is determined by leg length and the range of motion of the hip and the power in the leg extensors. Let's think about this. Now, going back into linking posture and injury and performance, again, leg length we can't change, but the range of motion of the hip and muscle strength related to leg extension can be changed. So think about that. So keep that one in your thoughts as we move forward. Going back to the mechanics, like any projectile, the distance the body will move once it is driven in the air, flight phase, on the angle of takeoff. This is referred to as the distance that the center of gravity is ahead of the toe off foot through the drive phase. So thinking that, moving into let's looking at the step rate. So better runners tend to have a higher step rate at any given speed. Step rate changes very little by speed when compared to stride length. So thinking about step rate, that's the governing body when it comes to the other factors or mechanical factors that you see there. If you look at the slide, it's step rate. Then you got the contact time. So contact time will be determined by step rate. The faster the step rate, the less contact time. When you're looking at oscillation, now oscillation, what this means is imagine you're on a bike pedaling. When you're pedaling, you're making essentially a circular motion with the foot. That is very similar to what's happening through the running gait. Every single time you go through a stride cycle, it creates an oscillation pattern. So oscillation is also affected by the step rate. The higher the step rate, the smaller the oscillation. And that is actually required because if you're having bigger oscillations, then it's going to reduce the amount of step rate. When you're looking at vertical foot movement, now that is the distance between the foot and the surface or the ground. That is also going to be dictated by your step rate. And then bounce. Bounce is going to also be dictated by your step rate. The higher the step rate, the less bounce. The lower the step rate, the more bounce. You can kind of imagine this if you're running outside, if you ever run outside and you're running on the sidewalk and there's a tree that hasn't been cut and the branches are hanging low, you kind of have to duck down. What happens is if you have a very low step rate, your bounce is going to most likely be higher, and guess what? Your head's going to be bouncing into the branches of the tree. So that's just kind of gives you a visual to kind of imagine. On the last aspect, what we're going to look at is the flight time. Flight time is not determined singular and is based on a culmination of flight times, and I say that plural, during the run, and can be determined by the distance being traveled. So, for example, using an elite runner, the flight time has been calculated to be up to 75% of the time it takes for the runner to complete 26.2 miles. So that's a huge amount of time being in the air. I mean, essentially, the last 25% that's remaining would be based off of the contact time and the step rate related to the running gait. For these next few slides, we are going to link posture and how this influences some of the running kinematics and create possible issues in her mechanics, such as her toe off, her step rate, her stride length, etc. So, okay, here is where we start to link posture and running. You've seen the image on the left where I went over posture assessment and identification in part 2 of this lecture series. This runner has hip and shoulder elevation, some trunk rotation, and posterior tilt of the pelvis, meaning that the pelvis is tilted backwards and her knees are hyperextended. So these are some of the obvious distortions that I saw during her initial posture assessment. So let's examine how this can potentially affect her running gait and mechanics. All right, let's look at this video of this runner. So what is obvious that you can possibly or may not see is some of the lateral rotation, some internal rotation of the femur. But think about what she had before, the hip hike or the elevated shoulder. This is going to influence some of what you're going to see during the running gait or and also some of the mechanics that go along with it. All right, so taking a look now at some images of that video that you just saw. I know the video was pretty short. It was hard to see. You can rewind it again if you want and just and look at it after you've gone over this particular slide. But again, like I mentioned, the video did show some lateral rotation and some sway coming from the left side. So think about her posture. Her static posture showed that she had a left hip elevation and a left shoulder elevation. So looking at the running gait, remember the running gait when we were talking about the swing phase, the support phase, and then the swing phase has 3 areas of the swing where you have the start of the swing, then you have the mid swing, and then you have the last swing or the terminal swing. So thinking of all those, I know this is confusing, but as you start progressing and start and look at these images, because the best way to do it is to really look at these images and continue doing it long after this lecture. That's where this practice will come in later. But looking at the image on the top left-hand side, you're going to see some internal rotation of the femur causing the knee to collapse inward. On the right side, also slight external rotation from the tibia causing the foot to evert slightly outward during the terminal swing or late swing prior to foot contact. So just take a look at that. You can see that. And then if you go to the next image, you can see some rotation, that right to left rotation, while her left foot is in terminal swing. So if you remember, and if you don't, that's okay. But she did have a left to right rotation. So that postural deviation is causing maybe some compensation where she is having to rotate more from the right to keep that even balance or that body feeling balanced through the range of motion. If you look at the backside on the bottom left of the bottom left image, you're going to see that elevation hip on the left side, the elevation shoulder on the left side. And that's when her left leg is in that terminal swing phase into the support phase. When you go over to that image to the right, you're going to see that when her right leg is in the terminal swing into the support phase, her shoulders are even. So that's interesting to kind of look at while you're seeing that, and how that posture, her static posture, is translating over into her dynamic posture, which is in this particular movement running. And then if you look how rotation, her left to right rotation and static is now involved in her dynamic in her running gait. And you see with her left leg in the terminal swing, about to make ground contact, she is having to pull further or rotate further to make the hips as even as possible. So that's again something interesting to look at. If you look at her back to that picture previous, you will see on her right leg being in at the terminal swing or the last swing, about to make contact, very little rotation. So again, this is how we can start evaluating, assessing, putting everything kind of together, because when you start to want to look at the programming on how to make this runner perform better, you have to address some of these factors in how she is going to go faster. But I mean, there's so many elements to that, but I want to start and introduce the posture element so you can start really going, oh, okay, this is starting to look like it's making sense, because how am I going to make someone go faster if they're rotated left to right and they're static, and now they're making compensations during the run to try to balance out. So that's something for you to think about. All right, so for this next runner, you'll see the grid that I just put up again here. So it kind of gives you a review of what we did in the part 2 of the lecture series, identifying posture distortions and assessment. So basically, looking at this particular runner, remember there was a right shoulder elevation, left hip elevation, some trunk rotation going on, and then there's that anterior pelvic tilt. So let's just see how this posture links to her running. I just want to note that this runner, she's a pretty experienced runner. She has done multiple marathons. She has been dealing with some hip-related injuries and also a foot-related injury also. So just to give you a background, her left foot she injured not too long ago. During that time that it healed, then her right hip started to hurt. So let's move on to the next slide. Let's watch the video. So taking a look at this video, what you're going to see in this video is different because we're looking at a different view. We are looking at the sagittal view, or the lateral view of this runner on the left side. When you do a 2D analysis, you're going to be doing the same thing as what you did in the postural and looking at all sides. So take a look at this, see what comes out obvious to you, and then we will go to the next slide and discuss further. Okay, so since we are looking primarily at this runner in the sagittal plane or lateral view, we're going to look closer in comparing some of the kinematics, the running kinematics associated, and then also with the posture. So again, think of the right shoulder being elevated, left hip being elevated, some left to right trunk rotation, and then the posterior pelvic tilt that was identified through the postural assessment in the lecture part 2. So looking at this, looking at her run at the top first image that you see, where you see the right leg in just about to make contact with the ground in the terminal swing, or what you would call the late swing. You could see that her hips are relatively level, but there is some rotation that's going on in the upper portion of her body, and when you look at that, you have to be able to look and be able to compare and identify, is that rotation more or less uh, when comparing it to the left leg going into the terminal uh, swing phase. And if you go to the bottom image, you're going to see that there is much more rotation associated with the late swing or the terminal swing as the foot is about to go in to the ground to make contact with the ground. I also placed a little red circle around her foot to show that also she has a pretty not severe, but a moderately pronated or a supinated ankle position when she does. So she's putting a lot of the weight on the outside of her foot as she makes contact with the ground. Um, Again, remember when we first began with this runner, I did give you a little bit background of some of the injuries that she has been dealing with, as being a pretty a pretty experienced runner. Again, looking at some of the foot and ankle stuff that you could see in some of the pictures on the far right, you could see that she's everted in the early swing phase of the gait, the running gait, and this shows some external rotation that is going on constantly. And think of when you're running, it's repetitive. And for her, she runs, you know, anywhere from 30 to 50 miles per week. So there, this does take a toll. In terms of her her anterior tilt, or the pelvis going forward, is going to be related to some of these kinematics that you are seeing throughout the running gait. So this is important to note when you are obviously putting together a training program to enhance performance. Again, we were talking about performance and injury and how those two are related, and how you will not achieve optimal performance if you are working under certain conditions, such as postural or posture deviations that are associated with the movement of running. Um, so this is a good example of just showing one view. In the previous slide, we showed you like the frontal view, and giving you an introduction into that. So this gives you now the other side. And again, remember, when you're doing a running analysis and trying to link it to the posture, it's important to, again, get all sides, like a 3D picture, but only obviously using 2D technology.
All right, here's our last runner that we're going to analyze in regards to the running gait and linking the posture to her running. So, just to give you a background with her, she is one who runs all sorts of distances from 5K, 10Ks, and half marathons. She has no real injuries that she's dealing with right now, but from the postural assessment and identifying some of the distortions, you'll be able to see in the next couple slides from her video all the way to the breakdown slide, where we're going to just break down some of the uh, uh, deviations that we see through her running gait, how that is being affected. So let's go to the next slide.
All right, so taking a look at another runner. You saw this runner's postural deviations in the part 2 of the lecture series. We know that she has left shoulder elevation, right hip elevation. She has valgus knee stress. She has everted feet, and on the left side, she has she's overpronated. So those are some of the main takeaways from her postural assessment. Um, in looking forward, you want to take those into account. Again, we're looking at the sagittal view or the lateral side. Okay, so let's look here at this runner. Again, remember we're looking at the sagittal view, lateral side. We only looked at the frontal view on the first runner that was presented in this lecture. So taking into account, so I did put the picture again, the image of the postural assessment and what we identified in terms of postural deviations. Going over it really quickly, left side shoulder is elevated, left side hip is elevated. There's knee valgus, there's everted feet, there is a left to right trunk rotation. She does have a anterior tilt of the pelvis or the pelvis going forward. So taking this in account, and then again, because we're looking at the side view of the runner, we'll look at the, again, the kinematics, the running gait, basically through the different phases from support to the swing phase. So looking at some of those images, you could see already that she is inclined every time she brings that front foot or the left foot into the terminal swing phase or the end or the late swing phase to hike that hip up. So there's like somewhat of a weight shift happening there. You can also, when you look at another kinetic checkpoint of your right foot, so if you look down, you'll see a red circle there. There is a lot of supination going on before she makes contact. When she lands, if you go above that picture with the red circle, you'll see her left ankle does a lot of pronation. So she overpronates a lot on that left side. If you look at the image on the with the green arrows, one going up, one going down, you'll see that her right shoulder likes to hike up during the arm drive movement when the left foot is in contact with the ground. You can see that in almost all the pictures that her right shoulder is hiked up more than her left shoulder. This is probably because of the deviation of her left shoulder being more elevated, so the range of motion in terms of the rotation is being limited, plus the fact that, remember, she is left to right rotated, so she has to compensate by rotating more to the right side. So that does translate and creates a little bit of a cascade effect from the shoulders going down to her foot and ankle complex. So that's good to know. When you see her in some of these pictures, you'll notice that there is that rotational arrow that I've signified by the green arrow. You'll notice also that her pelvic tilt is apparent on her right side, a lot more than on her left, which is interesting because her left hip is elevated. But that again shows you how posture will influence the running gait and through the different phases through the stride cycle. So this is the last runner. Let's move to the next slide. This is where we're going to have an activity that you can practice. Again, this is just to get yourself more familiarized, give you a newer perspective or a new perspective on how you're going to look at your clients or athletes. All right, okay, here's the time where we test your knowledge. And it's not a real test. This is something you can do on your own whenever you want. And just gives you another insight. And if you haven't already used this technology, this is gives you the ability to do this out in the field. Minimal, obviously, equipment is necessary to do this. So if you see the little icon that's in orange, that's called the Huddle Technique app. That's for iOS. I do believe Android does also have it. And then when you're the one to the right is also an app for iOS, but I do believe it's available on Android, and that one is called Coach's Eye. So the idea behind this is you can really kind of test your abilities and play around. Uh, both of these apps are pretty intuitive, easy to learn. It's just kind of hit and record, and then they have other features that you can either buy extra or they already included. And if you saw in some of these videos, I use the Coach's Eye. I've also used Huddle technique in the past. Um, they all have ability, as you can see from the pictures, to you can do joint angles because in a full comprehensive running analysis, there's actually ideal joint angles, range of motion in each one of the phases of the running gait. And that's something that you can teach yourself by going and learning that through some of the research out there. Um, but for this one, you can do the recording, and what I want you to try to focus on is identifying areas vulnerable to injury. Again, injury and performance. There is a correlation there. So using what you've learned from the posture identification and assessment process, you can look for the foot eversion, inversion, the internal, external of the tibia, the valgus, varus, knee stress, hip extension and flexion, increased lateral pelvic tilt, increased anterior posterior pelvic tilt, internal, external tibia, and rounded shoulders, forward head. And then possibly see how those are linked from your postural assessment that you might have done previous when you did this activity. Again, remember I did tell you back in the part 2 to keep some of any of those assessments that you practice on your own and then use those and have that same person that you got as a volunteer to run and do the recording. Again, remember when you're recording from the front view, backside, and then both lateral sides, the left and the right sides of the body. So that just gives you a full 3-dimension picture of that particular person that you're recording. And then have fun with this. It is a learning process. It takes a lot of practice. I am still learning also nonstop. I'm finding new research about it, and it's it's a constant educational journey. So download those apps and get to it. All right, well, that's the end of the entire lecture series. My hope was that you got a good idea in introducing you to postural assessment and identification, and then how that will link to your athlete or client, especially athletes or clients that like to run. So keeping that in mind, postural assessment and identification is a very useful tool when it comes to, you know, identifying, common musculoskeletal function, dysfunction, compensations, especially related to like functional movements. This can fully be adaptable to using on strength and conditioning clients. Looking at how they move through the range of motion in particular strength exercise movements. If just to give you an example, like
a barbell squat. You can take a look in terms of the hip position, how if there's an asymmetrical weight shift, things like that. So, I mean, this can definitely be applied to other types of training modalities to take a look. Are they working as efficient as they can? And if they are not, then that is your opportunity to use a tool like this too to optimize their level of performance through having this added skill set. And for those out there who already are pretty familiar with it, and a lot of times people who are in the corrective exercise or the physical therapy arena, that they have that prior knowledge already. But if you didn't think, oh wait, can I use postural assessment or identification to really help me analyze how some of my clients run, this is a way to kind of get more knowledge in being able to identify and then link it together. So again, thank you for watching this. If you have any questions or concerns, I will be providing actually on the slide you can see I will have an email address that you can email me. But again, thank you for your time. I hope you got something out of it. Take care.